This is kind of a recognition for me, but also for clinicians. It's not often that you have clinicians that are also physician leaders in digital healthcare. And it's a bit of a transition that we're seeing over the last couple of years where it's been more government health system leaders and vendors, and physicians that were there tend to be hospital-based or academics. But now we're starting to see more and more clinicians that are actually boots on the ground, and they've been kind of raised into leadership roles. So I have to say I'm really excited because it also shows that as a like a family or as a health system, we're starting to really look at how digital health is adopted where we actually see the most patients in the country. When you're a physician, this isn't what you're trained for, right? You're trained for something totally different. So I did 20 years of family practice in the community. And so digital health was just kind of like what you did from becoming a paper to like an EMR. And you don't actually think of it as a leadership journey. But since then, I've been with OntarioMD as their chief medical officer. And I find that what I've learned actually a lot is about collaboration. And when you actually meet people, everyone really has their heart in the right spot, right? It's really all about patients. And so whether you're government or a vendor or a clinician, everyone kind of has this idea that we're doing it better for patients. And so what I'm learning is that collaboration is where we need to figure out where we go. So it's a nice environment to be in. So you know what? I think it's bringing in teachings from elsewhere, right? We're really not leveraging that, right? We don't have enough speakers or enough like kind of just that lessons learned like from Australia, from the UK. Today there was some great talks, but I think that needs to be bigger. And I think we really need to start looking at other countries, other systems, and bring it together as a forum here. And I think Digital Health Canada could totally do that because no one else is doing it because we're siloed by province. So you really need to start pulling that in. I don't know about legacy, but what I'm hoping is that I want people to start understanding that clinical and digital are not separate. You can't go and have a clinical conference and then do a digital conference, not if you want patients. So we need to start pulling them together so that as you go to a clinical conference, the digital is there. Because I believe that clinical dictates digital, and digital is just another tool. But we are still thinking that digital is going to solve all the problems. But you still need to look at the people, the process, and the clinical. And then digital might be the answer, right? So I would love the impact and legacy to be finally for people to start shifting from here's AI, it's going to save your whole system, to let's figure out where the problem is. And I think AI is actually going to help in this place, but not as a global panacea. So, yeah.